7:23. Welcome back, Arizona. If your baby is having problems eating or sleeping, it may be more than an upset stomach. They may be tongue-tied, which has nothing to do with speaking. So Dr. Rez is here from Islands Pediatric Dentistry. Dr. Rez, I've never heard of tongue-tied babies before, so tell me what this means.
So we all have an attachment under our tongue that holds our tongue close to the floor of the mouth, and also the same band of tissue under our lip that connects our lip to the jaw.
Okay.
And sometimes this band of tissue is too tight or too short or just too wide, and it limits the ability for the tongue or the lip to move freely or normally.
So this isn't something that is discovered right away?
Very often, actually, because our doctors are not trained to diagnose and treat this issue, it goes undiagnosed for a long time.
So this would be something that would upset the child overnight, so if they're crying. How do we know that we want to have this looked at?
Oh, fantastic. So on the nursing parents, a lot of times we see kids who are having a hard time latching on. The latch is very shallow. Nursing is very painful for parents. They're hearing a lot of clicking noise when the baby is nursing because the lip cannot fold back to get a good seal around mom. So these are babies who are sucking a lot of air in. They get bloated, they vomit, or when they're feeding because they don't have the normal tongue mobility, they're chewing on mom. It's very painful. They're getting exhausted while they're nursing, and they fall asleep while they're nursing. So therefore, a lot of the times they're just not putting weight on. So if your latch is shallow, your baby's having a hard time putting weight on, or if it's painful, it's a great idea to get it checked out.
How fascinating.
Yeah.
Okay. You have a new laser to use in this procedure, correct?
Yeah. So the beauty of it is that this procedure has been done for a long time, but usually using a scissors or blade, which is very painful and uncomfortable, and the healing is very long. With the laser, the beauty of it is that as a surgeon, I have a lot of control over what I'm cutting. There's no bleeding. The pain is very minimal, and the tissue gets cauterized in about 10 minutes. And most of the times, the parents are nursing immediately after, and it makes a huge difference for them.
What is that healing process like?
It's about 2 weeks, and the parents need to massage the wound to prevent it from reattaching. But the pain is very minimal, and the issues go away very quickly.
And if you continue through life with this, what would that look like as an adult?
Sure. So I'm seeing a lot of older kids who are suffering from speech issues. So a lot of times when they're speaking, they have a lisp, or when they try to pronounce their R's, Z's, and TH's, they don't sound as clear. So speech issue is a big thing that goes away very quickly after treatment. The other big issue is sleep apnea at nighttime. If your tongue cannot go out all the way or up all the way to touch the roof of your mouth, when we're sleeping, very often the tongue falls in the back of the throat and restricts the air movement. So we're seeing a lot of parents and younger kids who are tossing and turning at night. They're very restless sleeping. They don't get a good night of sleep. They wake up very tired. They're grinding a lot. And we have a lot of kids who get diagnosed or misdiagnosed with ADHD simply because they're not paying attention in school, and that's because they're not sleeping well at night.
Oh my goodness gracious.
Yeah.
That's fascinating.
Amazing stuff. And it's life-changing, really.
Okay, so if you think your baby may be tongue-tied, go see Dr. Rez. He's over there at Islands Pediatric Dentistry. Passionate doctor who gives up his Labor Day weekend Saturday at 7:26 to be here to talk about this.
My
Thank
pleasure.
you, Doctor.